Oh, thank you all for joining me this afternoon. I am Dr. Shayla Toombs-Withers. I'm family physician and owner of Essence of Health Wellness Clinic. So, as you all have probably seen since you're here at the event, the Essence of Health has turned 1 year old as of this summer. And so I'm excited about that. And excited to have opened this clinic last year and for things to be up and running and be on our way and be able to take care of patients in this capacity. Um, and so I'm going to start, just with the background about why I opened the clinic and what the vision is for it has been for the clinic and how things work. And then I will touch on some of the frequently asked questions that I usually get from patients. And then I've got some patients who volunteered their time, and I certainly appreciate them coming just to share with everyone too. About Essence of Health, about direct primary care, what they like about the model, and just their experience within the model. Okay, so first, Essence of Health, it was open just to provide a unique aspect of healthcare to the Chattanooga community and its surrounding areas. I have practiced as a family physician for over 10 years now, and I've had the experience of seeing just many lifestyle challenges that we all face, and how those things impact our health, whether that be, because we don't have the time to consume a healthy diet, or we don't have the time to get out and exercise as much as we should, or we don't, you know, get enough sleep even, or don't get time to relax because we have stressful jobs and stressful lives. And so a lot of these things over time will play a part in our health, whether that be, we develop chronic diseases, or we develop a lot of acute diseases too. And so what that led me to was to want to provide care to my patients in a capacity where I felt like I was able to address those things and go beyond just the traditional way of treating people with just saying, hey, here's your medicine, I'll see you back, in a couple of weeks, and not really having that time to spend with patients and offer that type of experience with patients. And so a lot of what I do, I like to describe to people is holistic care, but it's where holistic care meets evidence-based science too. So a lot of people, will ask, well, are you a naturopath? Do you just provide, just prescribe supplements? And no, I am not a naturopath. I am a medical doctor. I did attend medical school. I'm an osteopathic physician. And so I prescribe medications, but we also do talk about supplements. We also do talk about how maybe if you can eat this instead of that, then maybe you won't need necessarily a medication for this. But medications have their place. And so we also, use those as we need to, as a part of your healthcare plan. But also in developing the healthcare plan, we also talk about other things that can be helpful. So maybe you need to sleep more. Maybe you need to exercise early in the morning because your day gets really busy. And so otherwise you don't find the time to. Maybe you need to spend 15 minutes just meditating, so that can help to bring your blood pressure down instead of us just increasing your lisinopril, for instance. So that is what I mean when I, say holistic care and providing that type of care. And so that also led me to direct primary care. So the model of direct primary care is not totally new, but it's new to a lot of communities. Direct primary care uh, practices have been around for over about the past 10, 15 years or so. There's some older practices out in the Midwest and the West area. And so it was a model of care to really take the middleman, if you will, out of medicine. And so the middleman is insurance companies and administrators who tend to make things more difficult for us to achieve the type of experience we want to have, and for patients makes it difficult for them to achieve the things they want to happen with their health, whether that be, the insurance declined your MRI, or they said, you had to spend this much amount before you were able to get the medicine you needed or the labs you needed. And so direct primary care was created to kind of prevent those hassles. And so what it does is the benefits it gives people, more charge over their health care. So one of the things we know that when we pay for things cash within healthcare, we actually are able to save money over insurance costs even a lot of the times. Most of us, especially now, have higher deductibles that we have to meet and pay. And with direct primary care and being able to pay cash, a lot of times you're able to avoid some of those higher costs within insurance. Now, which leads me to some of my frequently asked questions that we're going to go through. So really the first frequently asked question is, well, how does it work? So the way that things work at Essence of Health, it is a membership model of care. It is cash based. The rates for it, I take care of both children and adults. And so children range from $20 to $50. It's $20 if they are a part of an adult plan, and then $50 if the child is signing up alone without any adult plan. Then for college students, ages 18 to 26 with valid college ID are also at the $50 level. Then at any adults, so 18 and up, if they aren't college students or just adults out on their own, $70 a month. There is a $75 enrollment fee, which caps out at $150 per family with the enrollment fee. And so that's the rates of the membership. And then the way it works, so for that rate, it's withdrawn monthly with the auto draft, and that includes your office visits. So whether that be I need to see you here in the clinic physically, or if I need to see you on video, sort of like what we're doing now, or if you need to send me a text message because you have an acute concern, that's all included. So there is no reason to be concerned about, oh, my copay on my insurance says I have to pay $100. So I don't really know if I'm going to see the doctor right now because I really don't want to pay that $100. So it takes the guesswork out of it because it's that flat monthly fee. And then if you need to be seen, you're seen, and your needs are addressed as a part of that. The other things that's included in the membership plan are things that are done here in the office. So if you came in and had chest pain, you needed an EKG, well, that's included because that's part of me taking care of you. If we needed to find out if you were pregnant before we prescribed a certain medication, that's included into that. What's not included into that are your labs. So lab costs are separate. However, as being a part of the membership, you do get to take advantage of discounts on those lab rates. And when I say discounts, the rates are pretty great, even to a point of where a lot of my patients who actually have insurance prefer to pay the cash-based pricing, because once again, the insurance deductibles can be really high and you can end up paying a lot more over what the cash-based negotiated rates are. And so roughly they're going to be about 50 to 80% off of the cost of traditional rates. So what that looks like, for instance, most people at least see their doctor once a year and need a wellness physical. Usually the rates on those labs are going to be around $30 or so for a panel of wellness labs. And so that's not included in your membership. That is extra. Imaging studies are extra. If I needed to send you for an X-ray or MRI, that does cost extra, but I am able to, once again, help you with cash-based rates on that so that you are able to get those things at a lower cost than usual. Medications are not included in the price. However, I do dispense medications also out of the office, and they are at a reduced rate. I work with a wholesale pharmacy, and I am able to pass those savings along to my patients so that they are also able to save on those medication costs. So, which works really well, once again, for my patients who may be uninsured, and they, may need a maintenance medication. They may have high blood pressure. They may have heart disease, and so they need these maintenance medications. So we're able to get those at a really good rate. And also, I'm able to help people find lower rates. If I don't carry it here in the office, I'll help you find it and find it cheaply for you. And so that's also a part of what's included into that. The next question that's frequently asked is, do I take insurance? So no, I do not take insurance. However, I recently did the statistics on my patients. About 50% of my patients have insurance. About 47% don't. And then that other percentage of folks are actually on health share plans. And so I don't bill any insurance. And so those people who do have insurance are able to still use their insurance if they need it for things like their lab studies, if they need it for any imaging studies, if they need it, if you have to, heaven forbid, you need to go to the emergency room or you need to be hospitalized, then that's a perfect use of your insurance. Or if you need to see a specialist for whatever reason, then your insurance is still able to be used and still able to be submitted. I just don't bill your insurance for your primary care services here in the office. And even the insured patients still pay the monthly membership fee as a part of that. Next question I get a lot is, what if I have concerns after hours or over the weekends? So because you are a member of Essence of Health, you also get access as a member. And so what that access looks like is all of my patients get a phone number that they can send text messages to. They have a private email address they can send messages to, and they can call me if they know that they have, are able to reach me if they have some urgent need after hours or over the weekend. And whether that be we need to set up a video or chat or see you, then we make that happen for urgent needs. Another frequently asked question is, do you do pap smears? So yes, I do perform pap smears here in the office. Other women's health things that I do are IUD insertions and removals, as well as Nexplanon insertions and removal. The device is not included in the membership because the device is considered like a medication. And so if you have insurance, then we can certainly obtain the device through your insurance. And then if you don't, there are other ways of obtaining the device. And then we can perform the insertion here in the office. Another question I get a lot is, do you carry vaccines? So no, I do not carry vaccines here in the office. I do recommend that children are vaccinated because vaccines, they do save lives and they are helpful. But no, I do not carry them in the office because vaccines tend to be very, very expensive. And there are a lot of things that go with carrying vaccines in your office. I do have ways of getting children vaccinated, whether that be we have you get them done through the health department or work with a pediatrician to just obtain the vaccines, but do the well visits here in the office with me. Another question I'm often asked is, well, what if I want to cancel? Am I locked in? So if after all of these things, this great experience you had, and you still need to cancel for whatever reason, no, you are not locked in. I don't hold anyone hostage. Everyone, there's a 30-day agreement that we have. And so you give me a 30-day notice and you can cancel the membership at any time. Although I like to create a good relationship with my patients to a point of where people don't feel that they need to cancel. And then another question I have, so from business owners, especially being a small business owner myself, a lot of the times, the concern becomes, well, I can't afford to offer my employees health insurance, or, so what can I do? What kind of benefit can I give to my employees? And so one of the things we know is that healthy employees increase productivity, makes productive employees. And so when your employees are healthy, that's actually beneficial for your business. And so this is a way for small businesses to be able to offer healthcare to their patients. No, it isn't comprehensive. It won't cover everything, but it will cover their primary care, which for majority of people, primary care is really what they need. They need preventative care to prevent chronic diseases. They need management of chronic diseases. They need, those wellness checks. And so that covers a large part of their healthcare. And as a small business owner, those who enroll 3 or more patients, there are special negotiated rates for those business owners. And so it's definitely something to think about, how it can be helpful as a benefit into your small business, and how it can be helpful just to keep your employees healthy, keep them happy, let them take advantage too of that access to care so that your employees aren't missing work a lot, trying to get into this to see their doctor, because they can actually send a text or set up a video. I have, some people who over their lunch break, they'll hop on a video with me and get their visit done that way, and that way they aren't missing work. So as business owners, it's very helpful for your employees and their needs. And so those are the things that I wanted to be able to tell people about, and I wanted to address. Now, I do have some, so I've got two things going here. So we've got some people joining us on Facebook Live and some people joining us here in the Zoom room here. And so I've got some patients who are going to chat and tell us about their experience. And then if anyone has any questions, feel free to, if you're on Facebook, to put them in the comment section and I can address those questions. And then if you're here on Zoom, just put them in the chat and I can address those questions. But we will give a few patients a moment to share their experiences. And for my Facebook Live folks, I'm actually going to turn my camera so that you can see the Zoom room and be able to listen in to what these patients have to share. Okay, I think they should be able to. Oops, sorry for that, guys. I think they should be able to see you, maybe not. Okay. So I will let Shanika, I'm going to take you off of mute if you want to share. Nope, hold on.
Okay, can you hear me now?
Yeah, now we can.
Okay, perfect. Sorry about that. I have been a patient of Dr. Toombs-Withers since, I guess, right at the beginning. We became, I think, June of last year is when I started seeing Dr. Toombs-Withers. And I've started to see her for a number of reasons. One, I do have some chronic health issues that I just haven't done a good job of keeping in check. And knowing her personally, I certainly understand that she walks the walk that she talks. Like, she's been a vegetarian, vegan, living this plant-based life for a long time with her and her family. And she's had just demonstrable results with other patients. And the things that were working I was doing with my traditional doctor were not working. And anytime I would ask about more holistic, more diet-based approaches, there was just a push more medicine. And so I really just wanted to do something a little differently. And that's why I reached out to Shayla initially. I will say I've stayed for a number of reasons. One, the results. I've certainly seen my numbers improve. We're not where we want to be, but they're definitely getting better. And in the time that we've spent together, I've lost over 20 pounds, just kind of working the plan, not as much as I should have, but certainly using some of the tactics that she's given me has certainly helped. The best thing about this, though, is the extreme flexibility and efficiency. I am busy, just like so many people, between work and home commitments. My schedule can change at the drop of a dime. So I could have an appointment with Shayla on Thursday, and if I get notice of a meeting in the morning and our appointment was in the afternoon, then it's fine that I cancel, it's fine that I postpone, and I don't get one of those like 50% no-show fees because I didn't cancel in time. Just the flexibility that she has is certainly appreciated. And I would also add from an efficiency perspective as well, too. I've got a doctor's appointment today at 2 o'clock. I imagine I might sit in the waiting room for 45 minutes because that's what's happened with my last doctor. There's none of that, right? Like, we are start on time. So given the busy schedule, you're not sitting around wasting time. And there's always a very efficient appointment. She can take as long as I need to. Sometimes she'll take me on evenings. Sometimes she'll take me on weekends. But the flexibility and efficiency that she offers has certainly been one of the biggest benefits of working with her. And then one of the things that she talked about, because I'm not going to take over, is just a focus on kind of value and cost effectiveness. So I am one of the patients who still has health insurance. And if I think about going to my old doctor, they'd give me a prescription and I'd walk out of the door. If I get a prescription from Shayla, she's given me a bunch of samples. She's worked out a coupon. She's figured out the cheapest place to be able to get something. And I don't think that that's something that you necessarily get all the time with a traditional doctor. And so even by paying the fee on top of insurance with some of the discounts that she's able to provide, it has certainly been a big benefit overall from a financial perspective as well. So I am extremely pleased with my time with Dr. Toombs-Withers. And if you're thinking about it, if you're on the fence, I would encourage you to give it a try.
Thank you, Shanika. Okay, we will go to Celeste next. I'm going to unmute your mic, Celeste.
Hi, everybody. So I've been with Dr. Toombs-Withers for several months now. My reason for joining this program is because Dr. Shayla is interested in healing me, not just giving me medication to make my symptoms go away. She's interested in helping me learn how my nutrition can affect my high blood pressure, my obesity, all of these things. And so it's very rare to find a healthcare professional who wants to actually help you become healthy rather than just seeing you every 6 months and giving you more medication and just, kind of leaving you on your way. The fix is not always medication, and we know that, we've learned that. So that was my reasoning that both my husband and I became patients of Dr. Toombs-Withers. As far as the way the program works, it's fantastic because if I have something that comes up, I can send her a text message or an email, and she gets back to me within 24 hours. I remember one day I emailed her on a Saturday. Of course, I didn't expect to hear from her until Monday, but she responded within like an hour. So just she cares about you as a whole person, not just somebody coming through the door that she writes prescriptions for and then moves on to the next person. Every single experience I've had with her has been very positive. Every single experience my husband has had with her has been very positive. So just like Shanika, if you're sitting on the fence, I highly suggest and recommend that you try this way of getting physicians help because it's more about healing you as a whole person as opposed to just treating you as a patient. So that's pretty much where I am.
Thank you, Celeste. I am going to have Michelle next to tell about her experience. Let me see if I can. There we go. I think.
Can you hear me?
Yeah.
Okay. So I started with Dr. Toombs-Withers probably last summer. And I started because I wanted to see a doctor who had time to see me and not make me wait and then see me for 5 minutes and send me on my way. And when Dr. Toombs-Withers started this program, I immediately signed up and I was all in. She's amazing. She takes the time to talk to me, and the flexibility of it, as Shanika was saying, is a big part of why I go see Dr. Shayla Toombs-Withers as well. It's just been an amazing program. I get copies of all my labs. I get copies of everything that happens so I can keep track of what's happening along with Dr. Toombs-Withers. She gives me all of the progress notes. She sends me follow-ups, and I can reach out to her whenever I need to reach out. So that's my reasoning for joining, and it's been amazing.
Thank you, Michelle. And next I've got Kadena. I'm going to unmute your mic, Kadena. There we go.
Hi. For me, I've been a patient of Dr. Toombs-Withers since 2016 before she actually transitioned to her own office. And since day one, she's always made me feel like she cared about me as a patient. And that was important to me because every doctor I've had prior to her, I feel like they didn't listen, but they were quick to write me a prescription and send me out of the door. And with her, like, it was definitely a blessing in disguise. I would say that how we connected, because I was actually in a car accident in 2016. So I would say, like, overall, like, me choosing to continue my care with her, like, it's really been life-changing to me because she was the first physician to tell me that I needed to, like, have a wellness exam done. And prior to her, no one actually told me that I should get one done. So I would say just having that experience is very uplifting to me. It's hard for me not to get emotional about it because it just, like, the last 6 months even, like, have been very, I guess, like, overwhelming for me because I did have a health scare, and she just pretty much, like, been there and walked me through everything, and having her, like, here and available at all times, like, that's really essential to me because prior to everything, I've been fairly healthy. And I would say, like, it's it's a life-changing experience to the point where like I'm really interested in studying holistic medicine, because that's the path that she's like really steered me onto, like studying like my own like personal health issues and just learning more about holistic remedies overall. So I would say if you're on the fence about joining the program, that she's definitely the right person, and like she really loves what she does. She loves all of her patients, and everyone before me has truly spoken to her character and who she is as a physician.
Thank you, Kadena. Okay. And last but certainly not least is Miss Sheila. I'm gonna let you share your experience. If I can, let's see. There we go.
There we are. Well, I moved to Chattanooga area about a year ago from Southern California, and I had been part of a DPC out there, and my physician was also plant-based. And so when I came here, I was looking for someone, actually I was just looking for a doctor that was plant-based, that was their philosophy. And fortunately, I found Dr. Toombs-Withers, and not only was she that, but she was a DPC. And when we left California, we came out here and are both self-employed, so we lost our insurance that we had. So we joined a healthcare, and my healthcare actually pays more than half. So if I have a $70 fee, they reimburse me $40 for every month. So, I mean, healthcare through her is so inexpensive. The labs, I've just been amazed. It used to cost thousands of dollars. That was what they would bill, and the insurance might pay $300. I'm getting for like $30 or less. Sometimes like she'll say, I'm going to have you check this, and it was only like $3. So that has been crazy to me, but I certainly am so thankful to find her. I also love her because, first of all, I love the fact that, yes, she's accessible to me when I need her. Our appointments aren't rushed. She spends the time, and that's what I loved about my doctor in California too, because I never felt rushed and I could get in touch with him anytime. She's like that. I too have asked for a prescription on a Saturday, didn't think I would hear from her, and boom, she's got it checked in. The thing that I really appreciate about her though, is that I do a lot of research on the issues that I have. And so I'll send her like something that I found on the internet, and she'll look through it and give me her opinion. And sometimes she does her own research on things. So I just feel like I'm in very good hands. And to me, she's the best that I've ever had. I even like her way better, even than my doctor in California. So I think it's the least expensive form of healthcare, and she is just amazing. So I hope that you all join, and I love her. So anyway,
well, thank you
so much for your good care.
Thank you. Okay. I'm gonna turn this one back around. Thank you all very much for sharing your thoughts and your experience at Essence of Health. All righty, and so now I'm looking to see if there are any questions that I can address here. No specific questions, which is fine. However, I do, after, especially for my people that are on Facebook Live, after all of the videos, if you ever have any questions, I do revisit the comment section. So feel free to always leave those questions in the comments, and I can certainly get back to you. One of my patients did just send me a note to have me mention that one of the things that they do actually is use their health savings account to cover the membership fee, which is something that can be done because a lot of employers do offer a health savings account as part of your benefits package. And then you can use those funds to cover your month-to-month membership fee. Actually, that was actually one of the things recently that our government passed, where that folks could use those health savings accounts for that purpose. So that's good to mention also. And then also, as Sheila mentioned, with the health share plan, some of the health share. Well, let me rewind. So what is a health share? So a health share it's sort of similar to an insurance plan, but it's not. So the way a health share works is that you pay month to month, sort of like you would paying your insurance premium. However, the cost of it tends to be much more affordable than usual insurance premium rates are. And the reason for that is because they don't have a lot of overhead. They aren't, covering costs of all of these administrators with health share plans. And because really with the health share plan, you're part of like a community. And so you pay into this pot, if you will, month to month with the health share. And then when you have a need, for instance, if you have to have your appendix taken out, then the health share steps up for what you've paid into that monthly pot, and they cover your need for that catastrophic or that hospitalization type event. But health shares work really well with direct primary care from a standpoint that some of them even will cover some of the costs of direct primary care, because they know that your primary care part, which is the majority of healthcare for most people, is going to be covered at that direct primary care practice. And so they really help their patients see the benefit of having that preventative care and that well care, so that they know then it's not as taxing on the health share community, because in general, you're going to be healthier because you have all of this access to your primary care to handle the majority of your needs. And then when those special occasions do arise that you need a surgery, or you need to be hospitalized because you're in a car accident or anything, or you broke a bone, then your health share plan will kick in and they will cover those more expensive costs and those more expensive needs beyond the needs of your primary care. So thank you for mentioning health shares, Sheila, because yes, they do. They work really well with direct primary care. And even for employers and small business owners, there are health share plans that you, even as an employer, can subscribe to for your small business. And then you can also work with the direct primary care to cover the primary care part and have your employees on the health share part for their other part of their needs, and also save you money as an employer over what insurance may cost to provide to your employees. So that is something good to know. All righty. Well, I certainly appreciate everyone joining me today. And so I am going to end on the note of telling everyone how to reach me. So if you are looking for more information, I will say you can certainly visit the website, which is www.essenceofhealthwellnessclinic.com. I can also be found on Instagram at Essence of Health Wellness Clinic, and on YouTube at Essence of Health Wellness Clinic. Also on YouTube, you can find some of my other health talks. I didn't really do a health talk today, but this is an important part of your health, knowing how to access healthcare. But you can find some other more specific health topics on the YouTube channel at Essence of Health Wellness Clinic. And then I always offer a free virtual meet and greet, a 15-minute meet and greet appointment for anyone who's interested. So just feel free to reach out. You can call the office 423-225-2245 to set up a meet and greet appointment, or you can find out more on the website to set that up. Well, I am going to wrap this up and wish everyone a great weekend, and take care. Bye-bye.